Now, health experts are already sounding the alarm as they believe South Africa's fifth wave of coronavirus has begun. And this is because there's been a sharp rise in COVID-19 cases. In the last 24 hours, 4,230 confirmed coronavirus cases have been confirmed. Now, the NICD says that this represents a positivity rate of 16.8%. The Western Cape, Gauteng, and KZN have all registered the highest number of positive tests. However, the National Department of Health says it will watch the data closely before any pronouncements are made about a fifth wave. Now, how will these developments impact on the coming Eid celebrations? To answer this and more, I'm joined by Dr. Shameem Jamdullay. He's a senior research scientist at UCT's Lung Institute. Dr. Shameem, assalamu alaikum, and welcome to Salam Media. Good to have you with us.
Wa alaikum salam wa rahmatullahi wa barakatuh, Maulana, and thank you again for inviting me on your show.
Absolute pleasure, Doctor. So, Doctor, are we talking about the fifth wave, yes or no? We have experts on the one side saying, yes, it seems like the fifth wave is here, but the Department of Health say, no, we're just going to hang on and look at the numbers. What do you think?
Well, clearly looking at the evidences that are being produced and that are being put in front of our eyes right now, we are in the midst of the start of a fifth wave. Let me quickly explain. So we know that there are different things and different indicators that we can use to predict or to actually warn people when the next wave is actually coming. And obviously that comes with a surge in cases, and that could put some people at risk of, severe disease requiring hospitalization and even death, for some cases still, because COVID is still killing people. Let's not forget that. Every day we get a report from all kinds of media platforms, whether written or spoken, and people are still dying. So what we found out is that when they did the sewage analysis in the province of Gauteng, they have picked up more and more traces of the virus, which means that the number of infection and the number of cases is going up. Another indicator, which is also a scientific indicator, is the positivity rate. The positivity rate is basically calculated by taking the number of positive cases that we pick up, whether by PCR or by antigen testing, and dividing that by the total number of tests that's been done. So you can imagine if more tests are coming back positive every day, it means that the number of cases is rising. And what we also know for a context like South Africa is that we are always underestimating the real number of cases by around 6 to 8 times. So as the positivity rate is picking up and increasing, we also know that the number of undiagnosed cases, so people who test positive, who have the possibility and the capacity to transmit that virus to somebody else, and who are unaware of it, is increasing. And this is the danger. And this is why we raise the alarm early enough so that people can take the disposition to make sure that we curb that transmission rate as much as we can.
Okay, now talking about the curbing of the transmission rate, I look around me, Doctor, and I got to tell you that people aren't wearing their masks. People are not social distancing. Everybody's now very relaxed. The national state of disaster has been uplifted or has been repealed. So people are thinking really that we are done with COVID, but we aren't. Are we? We're not done, are we?
Sure. So you made a point. The national state of disaster has been taken away, but not completely, because it has been replaced by what we call the National Health Act regulation, right? So in a sense, there are still certain restrictions and certain regulation and certain things that we still need to do. For example, the wearing of masks in indoor spaces, because we know that this is a respiratory virus that we're dealing with, and that it can linger in the air. And these are from evidence that myself and my unit have produced that shows that there is a possibility that this virus can stay in the air in form of aerosols or droplet and be taken in. So there are certain good practice that we should still maintain. For example, the wearing of masks. We should also continue as much as we can, and especially during the rising cases right now, stick to having our gathering. If we have people from outside of our household, people who are not staying with us, we need to have these events, like for example, for Eid that's coming up if possible, in a ventilated space, in an aerated space, not necessarily outdoor, but at least open all your windows, open all your doors, and make sure that there is enough spacing between people, because these are essentially the most practical and the most efficient ways of actually preventing us from getting infected. Vaccines are good. Vaccines are there to prevent us from developing more severe disease, but the efficacy of the vaccine is not high enough right now to protect us against infection. So these are some of the practices that we still maintain. The wearing of masks, the aeration and ventilation of space or holding meetings outside, and also limiting the number of people that we are having in our own space. If we don't have the space for it, please limit that to whatever number that you deem is safe enough, and actually stagger it. We have 3 different meals in a day. You could have people over for breakfast, for lunch, and for dinner. And I think this is how we should have, and we should be celebrating this Eid, inshallah.
Dr. Shameem, last year we had the Delta variant that was wreaking havoc, and it really made our Eid much more different. Many people didn't go to the Eidgah, other people. But this year, with the Omicron and the sub-Omicron variants, how do you see Eid playing out in terms of infection control?
So again, we have always allowed us to be driven and to be guided by the evidence, right? Last year, as you mentioned, the Delta wave had already hit in other countries. In India specifically, remember the images that emerged of India around the time when they had the infection, people dying in the streets. There was not enough space to actually bury and cremate people. And the Delta variant was essentially the most virulent and the most severe disease-causing one that we had. And at that time, we told people to be careful. We had restrictions in place in terms of the number of people who could gather, in terms of, like wearing of masks, indoor and outdoor. And again, after that, when we got Omicron in December and November, keep in mind that restrictions were not actually increased. We did not impose more severe restrictions. On the contrary, restrictions were actually gradually being removed during that time. And again, this is because we allowed ourselves to be driven by the evidence. And what we know from Omicron is that it doesn't cause as many severe disease cases because it mostly infects people in the upper respiratory tract and not the lungs, where we get more complication. And again, I believe, like many scientists, that the next wave is going to be more benign, because this is also what we know as a virus is actually mutating and evolving, that it will take up characteristics that will allow itself to propagate itself better. So in a sense, we know that the transmission rate will be higher because the virus develops characteristics that allows it to transmit better, like Omicron, for example, compared to Delta or Beta that we had in December, January of 2020, 2021. And we also know that it's not going to cause as many severe diseases, because this is what we keep seeing, But again, we do have people who are in a certain profile, for example, the older people with comorbidities like obesity or hypertension or diabetes. And a lot of people have these morbidities or these diseases in parallel together. And this is what makes them more prone to develop severe disease and possibly die from that. And these are the people who we need to protect, whether it's in the Muslim community, whether it's in the Christian community. It's humankind, broadly speaking.
Absolutely.
Yes, and I foresee that by the time we get to Eid, inshallah, next week, the positivity rate would probably have gone above 20%. And we need to be careful about that. So people going to Eidgah and people going to mosque should take all the necessary precautions that they took last year, even though this is milder. So, for example, people need to take their musalla to pray on. People need to keep their mask when they're reading salah and when they are in closed spaces. People, if possible, need to space themselves and distance themselves, maybe not as much as we did it last year, but it's still important to take up measures that will allow us to protect not only ourselves, because we need to adopt that mentality of not being selfish and rather be selfless, because it could be our father or mother, it could be our grandfather or grandmother, it could be our teacher, it could be our imam that we infect, without knowing. So in essence, by protecting ourselves, we're protecting the community at large.
Absolutely. Dr. Shameem, you talked about positivity rate going up next week. I mean, that does make a lot of sense. If it's at 16.8% now, it's probably going to get 2020. Do you envisage any more restrictions? I think everybody, when they talk about high positivity rate and a lot more people being infected, even now there's like people sounding the alarm saying, hey, there's 4,200 something extra cases. So do you foresee any more restrictions or somewhat, yeah?
No, I don't think there will be any form of restriction. What we need to realize is, and this was made very clear and highlighted beautifully by Prof. Shabir Madi from WITS, who is one of the leading vaccinologists in South Africa and a global reference. He said that what we've observed now is a decoupling of infection and severe disease materializing. So what normally drives restriction, Maulana, is the fact that we are suffering in our hospital with the burden of cases that we have to cater for, and with the space that these people take in. And what happens is that it's not only COVID that then impact on the health of people and the livelihood of people. It's also all the other diseases that we could not find space in the hospital for patients, for example, cancer patients, for example, people with cardiovascular diseases, people with stroke. All these people suffered during our surges that we experienced with Beta or Delta because the hospital was full of COVID cases. But when we go back to Omicron in November, December, and the beginning of January this year, we also know that the number of hospital admission, the number of these cases that needed to be escalated to ICU for ventilation, and the number of people dying from COVID directly were extremely low. What we also found out was that most of the cases who we were reporting in hospital were what we call incidental COVID, which means that they did not come to hospital because they were suffering from symptoms due to COVID, but they were in hospital either to give birth, either to have an operation, for like a fracture or for any other things that is not COVID related. And as part of the strategy that was implemented then and that is still implemented, we normally test people for any inpatient. So if they need to be admitted for any procedure, they are tested for COVID-19. And this is how we've actually picked up a lot of people in hospital who were positive. So even the hospitalization of cases from the last wave were not really because of COVID, but mostly because of other things. So,
Dr. Shameem, I just wanted to ask you. Let me ask you a question, if you don't mind. Sorry for the interruption.
No problem.
We are told that of the 4,000 and somewhat cases that are that have been recorded, quite a large percentage are young teenagers who have been testing positive. Now we know that young teenagers can get vaccinated. They are eligible for vaccination. Why do you think there's such a high number of young teenagers, Dr. Shameem?
So, Maulana, it's quite simple, and for me, common sense more than my experience and my training of epidemiology tells me that there is a reason for this. And when we look back in history, like the last 2 years, remember that school was on and off, so kids were staying at home, and kids were not actually mingling, kids were not exposed to this virus. And it was mostly the adults and adults of working age who were getting infected and who were getting sick from this virus. So it is totally normal now that this population of younger, teenagers, kids, or even younger adults at university, because university even were closed, there were no face-to-face classes, everything became online. So it is quite normal that these people who've never been infected, who mostly have never been vaccinated, so who do not have any form of immunity, whether natural or artificial, against
Right.
the virus, are now getting infected. Because all these other people who've been previously infected, the older adults or adults of working age, I mean, I know, for example, where I work, people who've been infected 3 times already. And what I can tell you with reinfection, uh, what we see is that the symptoms are generally milder. And if somebody has been infected and is reinfected again, chances of that person developing more severe disease or even death are like very close to zero.
Hmm.
So
Fantastic.
it's because of this reason that we are seeing kids and younger adults now being the main drivers of this infection in the country.
Dr. Shameem, before I let you go, you did mention in one of the answers that you were giving some advice as to how we should, actually, spend our aid responsibly, non-pharmaceutical measures, so that we curb the spread. You said it in passing. Can you please reiterate some of those advices for our listeners that are looking forward to celebrating Eid? Eid in South Africa is a very big family gathering. People come and there's a lot of kissing, touching, holding hands, all of that. Please give us some advice as to how people should spend Eid this year.
Inshallah, that will be useful. So, let me start from the very beginning of the day when we go for our salah, whether Fajr
Right,
or Eid salah. So, even now when I go to the mosque in Cape Town, because I'm based in Cape Town, we take
right.
our own musalla. So that's one thing. We wear our mask and we keep our mask. We make wudu at home so that we don't actually go into the wudu kana facility where we have our mask down, we are touching common surfaces, we have water that's being used to rinse our nose, our mouth, where we do this virus can be found. So people take their own musalla, people wear their mask, people make wudu at home before coming to the mosque. There has to be some level of restriction as well with regard to the touching of people. Because let's be honest, if by the time Eid is there and we have a 20% positivity rate, you need to assume that 1 out of every 5 person in the masjid could potentially be having this virus and carrying this virus. So if we are going to embrace our brother, our sister, our kids, our family, our friend, we need to be very careful. I'm not saying, no, don't do that. Because, we need to live with this becoming endemic now. We can shake hand, but, keep your sanitizer bottle, sanitize your hand when you do that. If you are going to embrace your brother or your sister, keep your mask on, because this is definitely the best way of actually preventing transmission. Moving out of the masjid into the home, we also need to make sure that everything that we have is in open, ventilated space. People do not realize that the touching is what causes a lot of transmission, especially indoor. So whenever we're having a meal, make it such that there is minimal contact that is made with repeated surfaces, whether it's a spoon, whether it's a dishing spoon, whether it's opening something. Have everything set out there by one person who is safe, and this will allow people to actually curb the transmission rate when they are meeting. And as I said, also stagger. If you cannot have everybody there at the same time because of limited space, lack of ventilation, have groups of people coming. And again, this will all allow us to meet up, albeit with, like less time spent amongst brothers and sisters. But again, we are also warding off the transmission. And finally, the last thing that I think, it's not just COVID, but right now we are entering winter. And we
Right.
know that with winter, we also get the influenza virus that shows its head. And what we've seen now across the world is that people who get co-infected with both influenza and COVID at the same time develop more severe disease, and especially so in people who are older and who already have certain health problems. So my advice to people, especially people who are older, women who are pregnant, and people who have like a sickly, state of health, they should go and get their flu vaccine. they may not want to get a COVID vaccine because I know there's a lot of hesitancy towards that. But the flu vaccine has been there and has been around for decades now. So if they could all go and get a flu vaccine, and even if you want to get your COVID vaccine, it's not too late. There only needs to be 1 week interval between those two. So
Right.
I encourage people to go and get vaccinated against flu and go and get vaccinated against COVID. And inshallah, we will all be able to get out of this very rough time sooner than everywhere else around the world.
I mean, Jazakallah, doctor, that is some fantastic advice. I really enjoyed speaking to you. I love the way you explain the very difficult epidemiological aspects of the disease. Jazakallah khair, may Allah reward you. That's Dr. Shameem Jamdullay, Senior Research Fellow at the UCT Lung Institute. Jazakallah.
Assalamu alaikum.
Assalamu alaikum wa alaikum assalam wa rahmatullahi wa barakatuh. All right. I think many of us should have listened to that advice very closely, particularly on how we should actually spend our Eid responsibly. Ventilated spaces, stagger in your crowds that you've invited. Invite people for breakfast, invite people for lunch, invite people for dinner. Don't just have everybody here at the same time. That's the advice from Dr. Shameem. He talks about also touching. Let's be very careful about how we touch people. And of course, he talked about going to the masjid with the musalla, making sure that you make wudu at home, and don't throw away your mask. Very, very, very good advice there. Bringing our time to 29 minutes to 5 Central African time. We're going to take a short break, but before we do, Sentio is an ethically based asset manager that is focused on delivering superior risk-adjusted returns for their clients, regardless of market conditions. For more information on their Sharia investment products, visit the website www.sentio-capital.com and start saving towards your investment goals today. Sentio Capital Management, invest for good. Sentio Capital Management is an authorized FSP.